All right, you guys, welcome back. Welcome back. All right, so this session, what I'd like to do is go over Medicare.gov. In one of the previous videos, I had mentioned that at times, if somebody has a lot of medications or if you just need a second opinion, and instead of looking on Sunfire, you are able to utilize Medicare.gov to actually compare plans, sorry, complaints. Compared to or multiple plans. Well, it lets you compare up to three on a one-time basis, but there's multiple plans. Same thing if you're looking for prescription drug plans, if you want to just see for how much does the medication cost is, or does that medication cost looks as like it's the same as what you see on Sunfire. This is a great second comparison tool basically as well. Okay. Now I mentioned that you do not need a login to utilize the lookup tool. So here, for instance, you could just select find plans, and this is the home page. So that's the link. If you click on our link, that will take you to. And then over here, you see where it says continue without logging in. Okay, so you do not need an account to actually review plans and shop around. Here, you just answer a quick few questions. So in this case, since we are looking for Medicare Advantage plans, okay, you want to enter a zip code. So for instance, this one, and then underneath, it's going to ask you if you have any additional help. Medicaid, extra help, you don't get any, right? Or you're not sure. So in this case, I'm just going to say I don't have anything else. And then do you also want to see the drug cost for those? We definitely do, right? So I am just simply going to add here a few medications. Alrighty, we want to add it and then select dosage 30. That's perfectly fine. And I'll just do one more. Whatever comes up, I don't care, right? I'm going to add the generic, as you can see. So it does offer you to do the enter the generic as well. Generics are always less expensive, so be careful. In this case, I'm just doing it as an example so you can kind of see it, right? All the information. And then if you want to add another drug, you certainly can by clicking here, or you can add done, okay? And then in this section, it does allow you to add up to 5 pharmacies, all right, within your zip code. Clearly, if you do choose a pharmacy outside, but it is very important that you always ask your clients what pharmacy they use, because the price can vary based on pharmacies. If you just scroll down without typing anything in, you will see the pharmacies that are close by. So I always try to do a mail order unless the member told me that their mail gets stolen and things of that nature, then I don't do it. But otherwise, I always do up to 5 just to kind of compare, because just because they currently go to Walmart doesn't mean they have to continue going to Walmart if they're flexible, right? Because very likely there might be a pharmacy where the medication will be less expensive if they use the other provider. So let's just see what we can find. And then just to kind of for information purposes, so we have the county located right here. And you do have the option here, if you're just looking for PPOs, because the client tells you they don't do HMOs that are travel a lot, you wouldn't even you would just come in here and select that, right? And if you're just looking for PDP, you could also just select that icon and hit apply, okay? So we're going to leave it under all. Same thing, if you're looking for a specific insurance company, you could make the selection here. Plan benefits, yet again, I don't think it makes a big difference if you do apply that here. So I've never really tapped into that. Clearly, if you're looking at a 5-star plan because you want to use that SEP, then you would have to select that here. But the only 2 things that I really touch is only 2 to 3 is if I'm looking for a specific plan, if I'm looking for a specific carrier, and then also if I'm looking for people with Medicare and Medicaid, people who have chronic conditions, right? If I'm looking for a C-SNP or anything of that nature, then I would select those. Right now, I'm just going to look for a regular Medicare Advantage plan. So here we have 52, right? It shows 10 per page. And just to kind of go over the benefits here, you'll see the monthly premium payment for it. Clearly, if they don't have Medicaid, they have to pay the 170.10. Here you see how much they would pay on an annual basis for the medications. You see if there is a drug or health deductible and what the in and out of network expensive would be, okay? On the right-hand side, you see what all is included. So this plan, for instance, has dental included. If you see an X or you don't see a check mark here, that would mean that actually that is not included in this plan. And then also you see the co-pays as well as that this is an MAPD because drugs are included, okay? So as you can see here, transportation has an X, that means it's not included, okay? And just to kind of give you an example, it always does start off with the least expensive annual drug expense. So let's say I'll go all the way to the bottom, and I don't know why the computer is loading a little slow, so just bear with me. If I'll go to page 5, we were just at about $650, right? Just to give you an idea for the annual drug expense. We are now at $934, and it will continue to increase, okay, as you can see here. So it does show you that it does vary. And then also here, it shows you the plan has a monthly premium of $44, okay? So this is another way to kind of check the details. Now, if you wanted to compare 3 plans, we're just gonna check 3 boxes just to kind of show you. They will come up down here at the bottom as they slowly but surely are. My computer is doing a lot of work in the background, and then I'll just select one more. Excuse me. In just 1 second, guys, I have to answer the phone for one of my clients. All right, guys, I am back. And so here you would actually see the carrier's names if there is a monthly premium payment, right? You could see additional details here. We never enrolled through Medicare.gov. Okay, you see the star rating and all sorts of information, including what's included in the plan. Okay. And then really important, if you scroll down, you would actually see how much is the medication cost per insurance company. So here it looks like they're not a network, right? So, but the cool thing here is really you can tell which company charge or which insurance carrier charges how much for the medications. You would then take this information and just simply go back to the website, meaning Sunfire, and actually would start the enrollment. Okay. One other feature that I did want to show you guys, if you don't have access to marks, here on this side, you actually have the ability to, for one, apply for Medicare, which you see on the left-hand side. But what I want to show you is, if you don't know what plan the client currently is on and they don't have the ID card, etc., you can actually create an account, okay? And by creating that account, you would be able to see what plan they're currently on. So if the client or the member prospect does know their information, you could use it here, but you can simply click on create an account. It will ask you for their Medicare ID number. Okay, so they need to have that. We have multiple ways finding that. Then you need the start date for the Part A coverage. You would click next. Then it will ask you to enter the client's first and last name, their date of birth, and then it will ask you to create credentials. So it's a 3-step process with 3 pages. But then once you're in, you're actually able to see the member's account information. So I'm going to pause here, put one of my members' information in so that you can see what it looks like once you're actually logged in, okay? You do have the opportunity to do forget password if needed. If a member doesn't remember theirs, I think if you do it 3 times, it will then ask you a security question. If you don't know it, you're able to reset it. All righty, guys. So I am now logged into one of my clients' information, okay? But all I want to show you here is that right here, you would find the information. So you would see what current plan the client is on, okay? So just bear with me a second here. Here you would see what plan they're currently on, okay? And then also, if you click the plus sign here, you would see all of their plans. If they have currently Medicaid, it would also come up here at the bottom where it would tell you that they currently have Medicaid, okay? If you have any questions for me, let me just double check something here. But this is an opportunity where you can see that kind of information. You can even in here request an additional ID card if a member loses their card. You can even see if somebody has saved their drugs in here, meaning a doctor basically has it, then you could even go from their profile and say that you want to utilize all the medications that have been assigned to that member. But she doesn't have any, okay? So then you would just add them and okay, and move on. But that would be how you utilize Medicare.gov, all right? If you have any questions, reach out as always, and we'll go from there.